If your MRI is showing metastatic cancer in spine or possibility of metastasis in spine, what does that mean? If you have done your MRI for say back pain or any nerve related symptom and it is showing that one of your vertebrae is involved with some metastatic cancer or some cancer, then it might be primary cancer of the spine or the vertebral column, or it may have come from someplace other. Primary cancers of the spine includes plasmacytoma, evic sarcoma, osteosarcoma, but these are rare. Normally, spine is a foci for metastatic cancer. Now, metastatic cancer can come from other body parts like thyroid, prostate, lung, breast, and the most common being multiple myeloma. So, in such situations, cancer originates from some other place in the spine and slowly spreads to spine, leading to fracture or nerve compression. Now, the next step forward is once you have done the MRI, we need to do a PET scan to see the total extent of cancer spread. Like if the cancer is just localized to spine or it has spread to other organs also. Sometimes PET also helps us to localize the exact cause or the origin of the cancer itself. The third step in treatment or diagnosis comes when we do a biopsy from that area. Biopsy is like taking a small part of the bone or a piece of the bone from the cancer involved vertebra, and we do a histological examination and see what kind of cancer it is and what type of markers it has. So based on this report, medical oncologists will start the treatment of cancer. Now comes the treatment of spine fracture because of cancer. So this will go hand in hand with the treatment by medical oncologist, like starting the chemotherapy or radiotherapy. So when we continue with chemo and radio, most of the time we are able to control the cancer spread in the spine also. However, if there is a fracture, then we need to either stabilize it by using screws and rods, by doing a proper surgery, opening up the nerve and stabilizing the fracture. Or sometimes we do a keyhole procedure where we just put cement into that fractured vertebra through a small needle. This procedure is known as kyphoplasty. So if the symptoms are of nerve compression, say there is numbness, tingling in the legs, or there is weakness, paralysis, loss of motion or urine, then we do a surgery which is known as posterior spinal fixation with decompression, which requires general anesthesia. Or if there is just a spinal fracture without any nerve compression symptoms, then we do a procedure known as kyphoplasty. So treatment of spinal vertebral fracture goes hand in hand with the oncological treatment as advised by the medical oncologist. And in most of the situations, we are able to control the symptoms as well as the cancer very well. Thank you.